Hello, my name is Paul Molinaro. I work in the Health Emergencies Program of WHO. I'm the Chief of the Operations Support and Logistics Unit. As we have already learnt in Module 2, WHO released a practical guide for UN country teams, the operational planning guidelines to support country preparedness and response. This guide is intended to provide immediate support to governments and partners in implementing their COVID-19 country specifics during the period up to April the 30th. We have seen that the country guidelines are structured along 8 key pillars of the public health response, with underlying actions for enhancing country preparedness and response. The focus today is Pillar 8, Operational Support and Logistics. With this video, we will detail the 3 levels of actions included within this pillar and describe what each implies. This is relevant at country or sub-country level for UN country teams, governments and partners. The goal is that, after this video, you'll be able to conduct your own assessment using the WHO online planning tool for COVID-19. In Module 2, we covered several high-level actions of Pillar 8, namely that logistical arrangements and operations to support incident management should be reviewed in every country. This should include a mapping of available resources and supply systems and, if needed, the development of a central stock reserve for COVID-19 case management. Expedited procedures may also be required in key areas, for example in surge staff deployments, procurement of essential supplies and staff payments. Let's now detail each of these actions through 3 levels of prioritization. In the first level, we advise countries to map available resources and supply systems in health and other sectors. Countries will need to conduct in-country inventory review of supplies based on WHO's Disease Commodity Package, DCP, and WHO's COVID-19 patient kit, and develop a central stock reserve for COVID-19 case management. Currently, the PPE supply market is extremely constrained. Mechanisms need to be put in place at country level to coordinate the supply of PPE, especially for aggregating and prioritizing requests. Work is being done at the global level to alleviate this situation, but in the short term, PPE use must be rationalized to ensure the provision of vital protection to frontline health workers. In the second level, countries are advised to review the entire supply chain control and management system for medical and other essential supplies, including the COVID-19 DCP and patient kit reserve in country. This includes stockpiling, what, who, where, how much, storage, size, cost, location, the management arrangements, transportation, modality, contracts, partnerships, and the distribution arrangement, who, where, and the accountabilities. Additionally, countries are advised to review procurement processes, including importation and customs, for medical and other essential supplies. Local sourcing is encouraged to ensure sustainability. Through this review, a country can also assess the capacity of local market to meet increased demand for medical and other essential supplies, and coordinate international requests of supplies through regional and global procurement mechanisms. It should be noted that, for 11 critical items, PPE and lab tests, WHO is not recommending local procurement unless quality standards are strictly adhered to. We also recommend preparing staff surge capacity and deployment mechanisms. These include health advisories, guidelines and SOPs, and pre- and post-deployment packages, such as briefings, recommended and mandatory vaccinations, enhanced medical travel kits, psychosocial and psychological support, including peer support groups. Third level actions include identifying and supporting critical functions that must continue during a widespread outbreak of COVID-19. For example, water, sanitation, fuel, energy, food, telecommunications, internet, finance, law and order, security, education, transportation. Necessary resources and the essential workforce to do so should also be considered. Now that you have watched this video, you should be able to describe each key action in Pillar 8 and be ready to assess whether each has already been or needs to be implemented at a country or sub-country level. It is important to keep in mind that the actions presented in this video are a guide, should not supersede existing national guidelines and plans, should be used to rapidly adapt existing relevant national plans and accelerate preparedness. For more information, you may access the Operational Planning Guidelines in the Additional Resources section of the training platform. You are now ready to begin the assessment using the WHO online planning tool for COVID-19. Thank you for watching this video.